Let's start with EMS. If the EMS picks you up and brings you in, certainly they are the first responders. But if you come through the emergency room door, the first person you'll see is a triage nurse. That nurse will do an EKG, and that EKG will be performed within 10 minutes, oftentimes within 5 minutes of you presenting. They'll take that EKG to the physician who's available, quickly show it to him or her. He'll look at the EKG, and depending upon what he or she finds, they will activate our cardiac alert system. That means that the patient will be in a particular room, IVs are going, hooked up to a monitor, medications are started, and more importantly, they call the cardiac alert team. That consists of a cardiologist, nurses, and technicians. Going into a person's artery with a long tube called a catheter. That catheter goes in through the thigh artery, back up to the heart, or through the arm, back up to the heart, under X-ray visualization. And we can actually image through that tube by putting contrast, or we call it dye, into the artery, find where that blockage is. And once we do, we can put a tiny little balloon that's deflated in that artery, right where the blockage is, and inflate it, push that blockage out of the way. Most of the time, we combine that with something called a stent. A stent is a slotted metal tube that's crimped around that balloon that's deflated. And once the balloon is inflated, the stent expands and embeds itself into the wall of the artery, keeping the artery propped open. The balloon comes out, stent stays in, artery is open, heart attack is stopped. Heart disease is the #1 cause of death in adults in this country, and we want to do all we can to alleviate that. One of the ways we do it is we stop heart attacks in their track. We have a saying, time is muscle. The quickly you get evaluated, the quickly you open up the artery and get blood supplied to that damaged heart muscle, the better your mortality. That is, the better your chance of living, not only in the short term, but the long term. Less heart muscle damage means a better prognosis. We want to offer that in our community, not only because it's timely, time is muscle, you need to get it evaluated quickly, but we want to be a convenient source of quality health care in our community. So you don't have to go to Savannah or Jacksonville or some other large city and get the same type of quality care to treat heart attacks that we offer here at Satilla.